a second. Okay. Wait. Hold on just 1 second. We good? Okay. All right, honey. Could you quiet on this?
Stop.
All right. Could you please tell us who you are, who you work for, and where that is, how long you've been doing it?
My name is Wendy Rogers. I work for Dr. Hughes in Sandy, Utah, and I have had the pleasure of being in his practice for a year. Prior to that, I was in Colorado for 8 years.
Okay. So tell us about your pain experience. Tell us your story, what you've been through for the last ever, how many years?
I have had headache pain for quite a while. Sorry. Been to neurologists, been to several different doctors, and they just kind of make you feel like it's in your head. Nobody's really there to help you. I suffer vertigo really bad, have really bad vertigo, and I kind of put your life on hold. I've had to leave work. I know that I'm letting people down, and I don't like that feeling at all. So it's been hard. It's been a hard road, and this is a light at the end of the tunnel. So I'm excited about it.
I understand you played a big role in getting Dr. Hughes to sign up for this program. What attracted you to it? I can guess, but tell us.
I think just the education that I received just when we were learning about what TruDenta could do for our patients. Just the looking at, I didn't know anything about the whole occlusion end of it. I was excited about the neck and the migraine end of it. So that part of it excited me very much, because when you go to the doctor so many times and they make you feel like you're crazy, you guys, you knew what you were giving me hope, something to finally help me. So,
can you tell us a little bit about what you've experienced in the last few weeks when you've been undergoing these therapy treatments? How your life has changed?
I actually, I had my 5th treatment this weekend, and I'm actually a more pleasant person at my house, because I tend to go and do my job and go home and kind of hibernate in my room. It's hard to cook dinner some nights. Since having treatment, I'm able to go and be part of my family. So that's great. That's a huge blessing. And it's nice to wake up and not have pain in the back of my head, to not have it right behind my eyes, and to be able to focus more on what I need to do when I am at work and feeling good, and be able to come home and actually participate in my family and do the things I need to do with my family and other things in my life. So it's been an enormous change, or gosh, there's no amount of money that I wouldn't pay to have this done to make me feel better. It's great.
Now, I understand that when you first heard about the program and you understood about all this, thank you for sharing all that, by the way. What did you do with the patients that were coming into your office?
I started telling them how excited I was about the opportunity we were going to have to go learn about some new technology. I started just writing down a list of people who were experiencing the symptoms that I've experienced, and just letting them know there's help out there and we're going to get it for them.
How many do you have on that list now?
I have 25 on my list, but that's not including anybody who needs help for occlusion or who's in an NTI. I didn't even think about that. So it's going to be a lot longer when I get home.
Anything you want to say about the program this weekend? Any other feelings?
The program, I think, is great, and it's going to be, not going to be, it is life-changing. It is a life-changing program. The weekend was great. You guys did an awesome job. I loved all of your team, and it was very well presented, and you had great presenters, and as said before, it was very well organized. So thank you.
Thank you.